So fibromyalgia is actually one of the most misunderstood diagnosis or a disorder in the clinical medicine now. So 1 in 10 patients that we see in the clinical practice or an OPD setup, it comes with a fibromyalgia. It's actually more common than any of the lifestyle diseases like diabetes. Now, what is fibromyalgia? Now, fibromyalgia is a disease which presents with a chronic widespread pain. Patients will be having a diffuse, waxing, waning type of pain. And it is believed that fibromyalgia amplifies painful sensations, and that is the way that the brain processes pain signals. Now, it is actually not a type of arthritis because there is no inflammation associated with it that affects the joints or the muscles. Now, the clinical features, mainly the primary symptom of fibromyalgia is a widespread pain. And of course, it is actually a chronic debilitating condition. Can you imagine a patient living with a chronic pain? No, it's actually very difficult. And it, of course, affects the quality of life. And other than the pain, patients will be having other somatic problems like headache, neck pain, abdominal pain, diarrhea, etc. And also, the one symptom that the patient will present with is fatigue. Doctor, I am tired. I'm fatigued. I'm lethargic. Even if I sleep for 48 hours, I feel unrefreshed. So that is actually one of the symptoms associated with fibromyalgia. Patients will be having mood problems, associated sleep discomforts, etc. Now, the question was, what are the contributing factors? Now, the one thing actually fibromyalgia, one of the cause is there is a hypersensitivity to the pain signals. So it happens here. Okay. So what? So there is some imbalance between the neurotransmitters in the brain. That is the serotonin, norepinephrine, and the substance P chemicals in the brain. So there is some imbalance between it. And there will be a decreased pain threshold in us. So that is why the pain will be more sensitized. Now, that is one of the cause of fibromyalgia. Another factor is that there is a small association of genetic, that is, it could be a hereditary factor, that it could be running in families. And there is no specific gene involved in this, but there are chances that it could be running in families also. There is a genetic background associated with fibromyalgia cause. And the next important thing is the stress, the physiological or the pathological stress. And it is, of course, an important cause of fibromyalgia. Now, a lot of people can have will be reported to experience traumatic, distressing events, like it could be a sexual abuse or like any post-traumatic stress disorders will be associated with fibromyalgia. Now, not everyone who has fibromyalgia will be having this traumatic experiences, but now, in what type of patients we see this? Mostly it affects middle-aged population. More than men, of course, yes, women are most likely to get involved, but we have seen patients who are men coming with fibromyalgia. Now, so we cannot attribute fibromyalgia to a specific cause. It is believed to involving several factors like, say, genetics, as I told you. It could be preceding a viral infections, physical or emotional trauma. Yes. Of course, yes. Now it's a cycle. Stress is having an effect on the fibromyalgia, and the fibromyalgia can affect, it's a cycle now going on. Now, the COVID pandemic has impacted the lives and the health of patients or persons worldwide. And it is, of course, having an effect on our fibromyalgia also. Now, what are the stressors here? As we all know, financial hardship. A lot of people have lost their job, the work stress, the pressure, home loss, limited access to medical professionals, fear of contracting the virus. Of course, we are all scared that we will be getting the diseases and disrupted, and those who loves to travel will be having stress that they cannot travel, and a lot of people have lost their job. Now, all this mental health decline has affected the fibromyalgia to a very bad extent. Now, anxiety or stress, they have a direct effect on the physical and the mental well-being. Now, as we know that anxiety is one of the common associated symptoms in fibromyalgia, and it of course can be crippling or disastrous at times. An anxiety attack or a stress can trigger the flares. And of course, at the time of COVID-19 now, it is providing an opportunity for both the trigger and the flare-up of the fibromyalgia. Now, the one question is that, yes, can the COVID worsen the pre-existing chronic pain syndrome or the fibromyalgia? The patient with the chronic pain, on top of continuing to suffer from their usual symptoms of fibromyalgia, they're likely to have or experience discomfort because of the flu-like symptoms that they get from the COVID. It is possible that the patients with chronic pain have symptoms which are heightened. Of course, as I mentioned earlier, it's just the oversensitization or hypersensitivity to the pain. It's not really the pain. Whatever symptoms are they, it's just over exaggerated. And it would be now that is why we have to focus on educating the patients about their conditions and their symptoms, and also encourage to seek advice to self-manage their condition, as well as the treatment options for the prevention, that is mainly to decrease the flare-up of the illness. Now, for people who's living with a chronic pain or a fibromyalgia, it is very important that the fibromyalgia symptoms will be worsened. So it's a cycle, as I told. The problem of fibromyalgia here is there is no specific test, or we can go with a lab investigation or so diagnostic test like a scan or an X-ray to come to a conclusion that this is fibromyalgia. As we do in all the other diagnoses of clinical conditions, a good physical examination and a clinical history helps to do it. Now, what makes this fibromyalgia diagnosis challenging is that we will have to rule out any other diseases which can cause an secondary to this fibromyalgia. Like we will have to rule out if there's associated anemia, if there is a thyroid hypofunction, or if there is any other rheumatological conditions associated with it. Because there are secondary fibromyalgias happening. Patients who are having rheumatoid arthritis or a lupus can present with this. So we can't just say, oh yeah, the patient is having fibromyalgia. We just have to rule it out and see whether there's any other explainable causes to this fibromyalgia. Now, coming to the diagnosis of fibromyalgia, back then we used to use trigger points or tender points in the diagnosis of fibromyalgia, like 11 out of 15 or 18 tender points to the diagnosis of fibromyalgia. The American College of Rheumatology, they have come with a new case definition of fibromyalgia, the clinical features, which includes widespread pain and symptoms of fatigue, waking up unrefreshed, that is, the sleep abnormality will be there. And another associated feature is that they have a cognitive complaints. That is, there will be dysfunction in the patient's thinking, and also memory issues will be there. And other somatic symptoms like headache, diarrhea, abdominal pain, etc. Now, the revised guidelines says 3 points in diagnosing the fibromyalgia. I'll be sharing that. Now, there is a widespread pain index. A widespread pain index which gives a score more than 5 to 7 is one point. And the widespread pain index, it involves the shoulder area, the upper arm and below the waist, etc. And we are giving a certain points to that. And the total points, if it is more than 5 to 7, we can grade this as a fibromyalgia. And the next index in the diagnosis is the symptom severity score. So we can grade the symptoms from 0 to 3, from 0 being no problem and 3 being a severe. There will be fatigue in the symptom, there will be waking unrefreshed, and also other cognitive symptoms involving the mood and the memory. And the next thing would be the symptoms should be present at least more than 3 months. And also the patient should not have a disorder, or the patient does not have a disorder that would otherwise explain the cause. Now, as I told you, there is no specific laboratory investigation to diagnose fibromyalgia. As I already mentioned, we will have to rule out if there is any anemia, any electrolyte disturbances, any calcium or vitamin D deficiencies, any other rheumatological diseases associated with it. We will have to rule it out. Now, our research, our scientists we have to be very thankful to them. Of course, thanks to the scientists who got the vaccine so early, right? Now, each day, the diagnosis and the management of the fibromyalgia, they're progressing. So right now, there are actually few blood tests to see if there is a particular gene that is associated with the fibromyalgia, and also there is a diagnostic. And I don't know how far people are doing this, but the researchers are still coming out. There is a magnetic resonance spectroscopy. It is actually a non-invasive test that measures the biochemical changes in the brain. And that actually found out those patients having fibromyalgia have increased concentrations of neurotransmitter glutamate in specific pain-related areas. So there's actually a good improvement in the diagnosis of fibromyalgia. And also, the fibromyalgia diagnosis should be strongly based on the clinical findings. Yes, that is it. That is it about the management and the diagnosis of fibromyalgia. Of course, yes. Now, who is involved in the treatment of fibromyalgia? Is it only the doctor? No. We actually have a multidisciplinary approach. Of course, is it the family physician, or is it the primary care provider? Is it the rheumatologist? Is it the physiatrist, or is it the psychologist? Everybody is involved, even the patient, and also the family is involved. So coming to the management of fibromyalgia, I would say there are certain steps in the management. First thing is that, very important, patient education and their involvement. That is, explain to them about the diagnosis, the pathophysiology, the treatment options, etc. Include the family and others as appropriate. We have to involve them also. Discuss the concerns and the expectations with the patient. That is really helpful. Prioritize the symptoms with the patient, and also consider using a symptom diary, which will help in seeing what all new symptoms they have, and also in assessing how much the treatment effective is. The next thing, as we say, is pharmacotherapy. The good thing is that there are pharmacotherapy treatment to control the symptoms. There are a lot of drug treatments where the fibromyalgia management is considered. First, a lot of patients, it's actually subjective. It depends on the symptom, symptom wise. So it's a stepwise approach. It depends on the symptoms and the patient's preferences. A lot of doctors and we use antidepressants. Now, coming to antidepressants, a lot of patients ask, "Doctor, am I depressed? Or do you think I have a psychiatric issue?" No. Make them understand that the problem is with the neurotransmitters. We can't just give a painkiller, because it's just not the pain of the muscle or the tendons or anything. It's just the pain signals. So we will have to treat that. And that is why a lot of doctors, we use antidepressants and anti-epileptic. Antidepressants, we are actually starting it in a lower effective dose. It helps in the neurotransmitter imbalance in the brain. Amitriptyline we use, like tricyclic antidepressants, because a lot of fibromyalgia patients with the pain, they also have sleep issues. So if we consider taking amitriptyline, patients will be having a good sound sleep. So that can also help in the management of fibromyalgia. And many patients will be having other somatic features, and like neuropathic pain, they will be having pins and needle sensation. For those patients, we can be using neurotics like gabapentin, pregabalin, etc. can be helpful. Another set of patients, we can use muscle relaxants like cyclobenzaprine. And other set of patients, we can use non-steroidal NSAIDs we can use. For some category of patients, we can use an opioids. So it is actually differing from patients to patient and also symptom-wise. These are the pharmacological management. Now, other than the pharmacological, there are something called cognitive behavioral therapy, which is really helpful. Now, cognitive behavioral therapy is an effective method for functional disability and to improve the quality of life in the patients having fibromyalgia. It helps. Now, the basis of cognitive behavioral therapy is just to improve coping skills for pain triggers, and that helps in reducing the triggers of the pain also. Now, the next thing in the management is that sleep hygiene is very important. So to managing or improving the sleep hygiene is very important. And also there is other non-pharmacological therapies like aerobic exercises. That is really helpful. And there is like stretching, flexibility, muscle strengthening exercises. They are slowly graded exercises which helps in the management of fibromyalgia. And how can an aerobic exercise come in the management, or is it a specific, we can't say it is a specific therapy, or how aerobic exercise helps in the management of fibromyalgia? Doing exercises helps to increase the muscle oxygenation and also helps in increasing the muscle circulation and reduces the inflammatory symptoms and also the pain and the fatigue of the muscles. It's just a slowly graded exercise. And what I would say to my patients is something called Jacobson's relaxation techniques, where there is intermittent relaxing and tensing of the muscles, which will really help them. And as I told you in the diagnosis, the researchers have also come with another therapy called hyperbaric oxygen therapy. It's called. Now, what is hyperbaric oxygen therapy? It's a new treatment guidelines for fibromyalgia. It increases the intracellular oxygen levels in the mitochondria, which produces the energy better and gives energy and also reduces the symptom of fibromyalgia and also helps to reduce the flare and the pain. Now, during this treatment called hyperbaric oxygen therapy, the patient is made to breathe 100% oxygen, which is pressurized to twice the normal air pressure. So it increases the oxygen levels and also improves healing. Next thing that I would say in the management of fibromyalgia is something called Calmare therapy. It is actually a pain therapy medical device. It creates and sends no pain signals, which becomes the dominant signal received by the brain, thus reducing the pain and providing relief to the patients. Yes. Yeah, actually, as I mentioned, there is no specific age group where fibromyalgia is affected. And the diagnosis can be challenging because it can affect a teen, it can affect a middle-aged patient, it can affect an elderly. So it will become very challenging in each age groups. Are we missing out anything? Of course, in elderly, are we missing out the important rheumatological conditions? In middle-aged, are we missing out lupus or any other chronic pain disorders? Now, of course, there is a relationship of age and symptom severity and the quality of life. Now, I would say that it would be more challenging in a young and a middle-aged patients. Now, what are the reasons where that could be challenging? Because young patients, middle-aged, I am healthy. Now, that is one perception that their age-related expectation will be there. Younger patients are expected to be healthy and engaged in active lifestyle and less likely experiencing the pain and symptoms of fibromyalgia. So I would say all the age group can be challenging, but it could be in a middle-aged, which we'll have to keep our eyes wide open, which we are not missing anything or not. Another challenging point is that now, given the high prevalence of multiple comorbidities in our elderly population, many of which share symptoms of fibromyalgia, of course, like COPD, chronic heart failure, renal insufficiency, mood disorders, osteoporosis, polymyalgia rheumatica, etc., we will have to keep everything in mind before ruling out it is a fibromyalgia. Now, the common and the characteristic features of fibromyalgia among our geriatric population include chronic musculoskeletal aches, and stiffness in multiple sites, and also modulations of aches and pains by physical fatigue, poor sleep, weather factors, and general fatigue, etc. Now, the misdiagnosis and inappropriate treatment is very common in elderly populations, and that is it. That is, of course, geriatric population is really challenging when it comes to a fibromyalgia diagnosis and also the treatment. Yes, that is a very important question, because not only fibromyalgia, any diseases, medication overuse. Now, this is a chronic widespread chronic pain syndrome. So we will be giving them a lot of mixture of medicines. They could be opioids for controlling the pain, many antidepressants, many anti-epileptics. So how can we prevent a misuse or overdose of these drugs in these patients? Now, the first important thing is that we have to be open to the patient and tell them that this disease is not something from the brain. It is a real disease. We will have to explain it to them. Tell them what are the benefits and the risk factors associated with each drug. Now, I would say a few points where we can avoid. How? Start with a low effective dose. During the workup or during the review, we have to document the progress, whether the patient is having any improvement on the symptoms. We can't just prescribe any medications and send the patient home. We have to explain it to the patient. These are the side effects. These are the alarming signs which you will have to keep in mind when you have to report back. And also, when they come back, ask them particularly about the side effects. How are they taking the medications? Explain it to them. Are they missing the medications? That is why the involvement of family is also important in the management of fibromyalgia or any chronic pain syndromes. Now, when they come next, or keep in mind in planning of tapering the medication slowly and discontinuing the drugs. Assess the risk for overdose, like if the patient is having any risk factors. Is the patient having any other associated psychiatric conditions, any other risk factors for overdose, any previous episodes of overdose, etc. And I would say encouragement of family involvement is very important. Now, once medication, as I told you, we will have to re-evaluate, and they should be re-evaluated regularly, and with regard to previously set goals of pain relief and the functional improvement and the quality of life.